what percentage do you think failed because of this they're just missing it. They're not seeing it.
Yeah.
What do you think that is?
I think it's a combination of all three things that we've talked about. The diagnosis part, I think I see a lot of lazy diagnoses. I also see poor PRP being injected. Again, they're going based on what the sales rep told them that their PRP kit makes, and they're trusting that. And then the third is the image guidance. Is they're missing the mark on where it's being injected. And I think there's a large percentage of clinics that fall either in all three of those categories or one of those where that outcome falls off as a result. And so if you're not covering all of those, you're missing the mark completely on an effective treatment.
But if you want to think about this, just one way of thinking about it, they are still in business, those clinics, which means they're getting still success with being just still 2.0.
Yeah.
In some cases, barely even that.
Yeah.
They're still successful. Now you put all those three things in there. That is what I love about this.
Right.
We're delivering something that has all of that.
No, that's a valid point there. I mean, that's not to say that those clients aren't getting good outcomes. It's just, could they be better?
Yeah.
I think so. Just like with hormone care, there's certain types of hormones and delivery mechanisms that do get results, but is it the best? Is it the best results that you could get? Is it the safest result you could get? And again, same philosophy applies. We have enough research now that tells us that these are the best ways to approach this. Let's follow them. Let's put in the extra work. But that is also, going very back to the beginning, is why being so dedicated to this craft and this area of medicine is so important, because there is so much involved. It's changing so quickly that you have to be someone that is fully dedicated and not trying to put their hands in too many different pots. And as a result, something's going to have to give, or you're going to have to sacrifice somewhere else. Whereas, if I have a patient, I recognize some hormonal deficiencies or something that I know you guys can help with, I'm not going to try to mess with that. I'm going to send them over, get that foundation healthy. And then, that's where this collaboration works super well too. Yeah.
And I have these conversations all the time, and it's really means a lot to me that we can sit down and have this, because it is confusing for you as a patient. And the one thing that this practice is dedicated to is what we just discussed, a level of accountability to that. When we do something, when you come to see us and you give us that trust, we work so hard to earn that trust.